So now we're gonna work on using Sculptra for facial rejuvenation. Look at Revay's face. Go and lay back. Did we wipe her? We wiped alcohol, please?
Dr. Ferris says, I love your work, you inspire me, from North Africa.
Oh, hi. Thank you. Well, I've been using Sculptra polylactic acid, or we call collagen stimulating injectable, because if you look in here, there's a little snow globe. I always tell people this is the Sculptra snow globe, and there's little white particles in there that have been diluting for a minimum of 72 hours. In my practice, we go through hundreds a month, so we usually are always having this diluted and ready to go. And in someone like Revay that already has a nice contour, all we're gonna do is focus on the main areas that people notice loss of contour and aging. Temple, lateral cheek, jawline, chin, nasolabial fold, okay? So let's start with the temple. We're gonna go real deep, nice little pinch, 1, 2, 3, not the best feeling in the world. And also a weird sensation because you're all the way on the bone, but you can hear it. It almost feels like everything's going into your brain, but it's not. It's in a really safe area. We're gonna follow the lateral cheek, smile as big as you can, that nice relax, and we're gonna go a little pinch right along that bone, nice little lateral cheek elevation. Okay, just a little right there. Smile again, relax. Then we're gonna go right into the upper part of the upper cheek and just distribute into the cheek fat pad. That's perfect for that upper face section, okay? We're gonna do that same thing on the other side.
I didn't,
Oh, how did it feel?
actually, that was, to me, easier than I expected. Like, the temple didn't
See,
hurt.
that's
He's like a ninja.
Dr. Emer, the filler ninja. Hold right here. So again, if it's really well diluted, there's numbing inside. You could see here the little snow globe of the particles. And you always want to make sure you can go out. We're going to do the same thing over here, going to a really safe plane all the way down onto the bone. I do my little vibration technique so people don't feel much pain.
Totally helps, too.
Okay, little of that. Then again, following that lateral cheek, we're gonna go deep onto the bone, real quick, just a little pinch, nothing crazy. If you want, and you're starting to learn, you can do this little aspiration technique. See this right here? Where we aspirate in the tissue just to make sure there's no bleeding, which I just did to show you that. And then again, smile, inject. And remember, Sculptra is a diluted particle, so it's going to look bigger right now because that's gonna push the particles all in the tissue. And then it'll go down. So switch sides. Go ahead and hold there. Try again, Ben. Go ahead.
My lashes stuck together.
Great. Now we're gonna work our way down along the jawline, okay? And to really get a nice contour, turn here. You turn a little bit. She's got that Sandra Bullock, that Ariana Grande, beautiful jawline. So we're gonna go
everything.
right along the jawline, and we're just gonna do a little thread of the Sculptra there. And we're gonna come back 90 degrees, and we're gonna do a little thread of that Sculptra right back in there. Okay, and then another in that 45-degree angle right here. Perfect, now that's been there. And then we're gonna go right into the edge of the chin here, where we want the chin to project a little bit right on the bone. Perfect, and that's gonna give her that nice 90-degree elevation, okay? Switch the sides. Okay, and this is how we do full facial Sculptra contouring. Again, all the way back onto the jawline, nice little bit, beautiful. Following the line here, right at the edge of the jaw, going really deep, right on there. And then again at that 45-degree angle. We want to get collagen production. That's going to basically fill this area. And then again, right on the chin, right at the edge of the chin where we really want some contouring. Going right at the edge there.
How often do you recommend patients use Sculptra?
Well, once you do a series of building, you can do it once to twice a year after that. So people will often say if you're 60 and you're just starting, you're gonna need 6 vials that first year. If you're 20 and you're first starting, you might only need 1 or 2, okay? Now the last part is to give a little bit to the, what we call submalar area, which is the lower part of the cheek, and that gives some elevation and some contouring, just a small bit. And then a little bit to the nasolabial fold, because as we age, that area kind of descends, and the actual fat pads push the mouth in a different direction and the cheek in a different direction. Turn over here. Perfect. We're in the submalar area, which is a little bit right under the cheek. Okay, and then we're going right into that nasolabial fold, all the way in. Perfect. And that is full facial Sculptra contouring. How did that feel?
With no numbing Actually, it wasn't that bad.
with really
I
no
feel more
numbing.
awkward because my face is numb now.
I know, exactly.
So I look like I have
You know, you could always go a little bit more projection in the chin. You could build out this jawline a little bit more cheek. I think she has enough. I think that's a perfect amount. You don't want to overdo it. You don't want to make her look done. Long term, this is going to build collagen over time. So